If you've ever been prescribed an antibiotic for an infected tooth, for a toothache that wouldn't quit, or watched your child go through the same thing, you might be surprised to know that antibiotic actually doesn't cure the infection. What do I mean by this? All right, we're going to jump into this today. We're going to talk about what a tooth infection actually is, why an antibiotic is really just a band-aid for it, when you absolutely need one anyway, and then, because I know this is what a lot of you are actually here for, 10 home remedies that can genuinely help ease the pain while you're dealing with this, without pretending any of them cure the underlying problem, because they don't. And I'm not going to tell you they do. Let's get into this and really figure it out. First, what is a tooth infection really? If your tooth has had a toothache, or sometimes it doesn't even hurt at all, which always catches people off guard, here's what's happening underneath the surface. When the nerve inside a tooth dies, the infection inside that dead nerve tissue doesn't just sit still. It spreads, the way every infection spreads, out past the end of the root and into the surrounding structures. There's a ligament called the periodontal ligament that connects the tooth to the jawbone, and as bacteria push out past the root tip, that ligament gets inflamed. The bone around it gets inflamed. Sometimes the gum tissue gets inflamed too. And that's when you really feel it, that deep, throbbing pain that doesn't let up, tenderness when you bite down, swelling that shows up along the gum line or even out toward your cheek. When pain sticks around for minutes at a time, or hours, and doesn't fade the way normal sensitivity does, that's your sign you're not dealing with a simple cavity anymore. You're dealing with an abscessed or dying tooth. It's worth knowing that not every abscess starts the same way. Sometimes it begins with deep decay that eventually reaches the nerve. Sometimes it follows a crack or a hard blow to the tooth that damages the nerve without leaving any obvious outward sign for a while. And sometimes it develops more gradually through advanced gum disease that eventually affects the bone and ligaments supporting the tooth, rather than starting inside the tooth itself. The end result across all of these paths looks similar: inflamed, infected tissue that your body is actively trying to fight off, but the starting point matters for how a dentist ends up treating it, which is one more reason a proper exam and x-ray matters more than trying to self-diagnose exactly what's happening based on symptoms alone. At that point, a dentist may prescribe an antibiotic, and I want to walk through exactly what that antibiotic is and isn't doing, because this is the part almost nobody explains clearly. Antibiotics do what antibiotics do. They go after bacteria, they fight the infection, they push the bacterial population back, and the inflamed tissue around the tooth starts to calm down. The swelling goes down, the throbbing eases. You might be able to chew on that side again within a few days. And it's incredibly tempting at that point to think the antibiotic fixed the problem. But remember what actually started this whole thing. It wasn't the bacteria showing up out of nowhere. It was the dead nerve tissue sitting inside the tooth that gave the bacteria a place to live and multiply in the first place. As long as that dead tissue is still there, bacteria are going to find their way back to it. This is the pattern that plays out constantly. Someone takes the antibiotic, the infection quiets down, the pain goes away, they feel like they dodged a bullet and move on with life. Then 8, 10, 12 weeks later, symptoms creep back, sometimes worse than before. Why? Because the dead tissue that started this entire chain of events never left. It's still sitting there. This applies to adult teeth. It applies to children's teeth just the same. An antibiotic never addresses the root cause. It only quiets the bacteria that showed up to feed on it. So many people ask some version of the same question. Why can't I just take an antibiotic and be done with this? Why can't a course of antibiotics just handle an infected tooth or an infected root canal tooth the way it handles a sinus infection or strep throat? The answer is always the same. The dead tissue is the actual problem, and an antibiotic can only temporarily subdue whatever bacteria has found that dead tissue. The bacteria come back, again and again, as long as that tissue remains inside the tooth. That's exactly why an antibiotic, on its own, is a band-aid. It treats the symptom, not the source. Now, sometimes that band-aid is absolutely necessary, and I want to be very direct about this part because it matters more than anything else in this video. There are real, documented cases, the kind you can find reported on the news, of people who have died from untreated tooth infections. I don't say that to scare you for the sake of scaring you. I say it because it's true and because I don't want it to happen to you, your child, or anyone you know. So let's talk about what a serious, escalating abscess actually looks like. If you have facial swelling, especially swelling you can see just by looking in a mirror, if that swelling is moving upward toward your eye or the area around your eye, if it's moving downward toward your throat or affecting the area around your airway, if you're noticing any change in your ability to breathe normally or swallow normally, if there's noticeable redness, heat radiating from the area, or a fever. Any single one of those signs, in an adult or in a child, means it is time for an antibiotic, and it likely means it's time for an emergency room, not a routine dentist appointment scheduled for next week. In that situation, you are not fixing the underlying dead tissue with that antibiotic, but you are quieting a dangerous infection down before it spreads somewhere you really do not want it to go. Infections in upper teeth have a pathway that can move toward the brain. Infections in lower teeth have a pathway that can move toward the airway. These are not hypothetical worst-case scenarios pulled out of thin air. They're documented, serious outcomes, which is exactly why any outward sign of a spreading infection in an adult or a child warrants an immediate trip to the emergency room, not a wait-and-see approach. In that emergency setting, they may give you an antibiotic through an IV instead of a pill. Why choose an IV version over a pill? Because it moves fast. An IV antibiotic gets directly into your bloodstream and starts working immediately. An oral antibiotic has to go through your digestive system first before it reaches your bloodstream, which takes more time that genuinely matters when an infection is actively spreading. So to be completely clear, an antibiotic is absolutely necessary in situations like this. It protects you from a potentially life-threatening outcome. If a dentist or an emergency room has recommended an antibiotic for you or your child, and you're seeing any of the swelling or breathing-related symptoms described above, take it. Full stop. I hear from people regularly who say something like, "I really don't want to take an antibiotic. I know what it does to my gut. I'd rather avoid it." I understand that concern completely, but there is a difference between avoiding something out of general preference and refusing something that exists specifically to protect you from a serious, escalating medical situation. You can absolutely take steps to support your gut afterward. What you should not do is decline an antibiotic when you're showing the warning signs just described. So you take the antibiotic, the swelling goes down, the acute danger passes. What happens next? This is where the same point from earlier comes back around. If the nerve tissue inside that tooth is already dead, if it's already infected, if bacteria has already worked its way through the structure of the tooth, the long-term path forward usually means either a root canal to remove that dead, infected tissue and seal the space, or removal of the tooth entirely, often followed by a replacement like a dental implant. Antibiotics were never meant to be the final step. They're the emergency brake, not the destination. Picture a fairly common version of this. Someone has a dull ache in a lower molar for a few days, nothing dramatic, manageable enough that they push through work and errands without thinking much of it. Then one evening the pain sharpens, keeps them up half the night, and by morning the side of their face looks slightly puffy in the mirror. They see a dentist, get prescribed an antibiotic, and within 3 or 4 days the swelling is gone and the ache has faded enough that they genuinely forget about it. Life moves on. Then almost exactly 10 weeks later, a familiar dull throb shows up in that same tooth, quieter than before, easy to dismiss as nothing. That quieter return is exactly the pattern described earlier. The antibiotic handled the bacterial flare-up, but the dead tissue inside the tooth that caused the whole thing in the first place was never removed. so it was only ever a matter of time before bacteria found their way back to it. This is why dentists so often push for a root canal or extraction once a tooth has died, not because they're being overly cautious, but because leaving dead tissue in place is leaving an open invitation for the exact same problem to repeat itself, sometimes with less obvious warning signs the second time around. Now here's the part I know a lot of you clicked on this video for. What can you actually do at home to ease the pain while you're waiting to get in front of a dentist, or while you're dealing with milder discomfort that isn't accompanied by any of the swelling or breathing symptoms just described? I want to walk through 10 home approaches that people commonly use to take the edge off tooth pain. None of these cure an infection. None of these replace a root canal, an extraction, or an antibiotics when one is genuinely needed. What they can do for a lot of people is make the waiting period more bearable and take some of the sharp edge off the discomfort. Number 1, a warm salt water rinse. Dissolve about half a teaspoon of salt into a cup of warm water, swish it gently around the affected area for 30 seconds or so, and spit it out. Don't swallow it. Salt water is mildly antiseptic and can help reduce surface bacteria around the gum line, and the warm water itself can bring some temporary relief to inflamed tissue. This is one of the oldest, simplest home approaches out there, and it's still one of the most commonly recommended because it's genuinely gentle and low risk, and it can be repeated several times a day without much concern. Number 2, a cold compress against the outside of your cheek over the area that hurts. Wrap ice in a thin towel, never place ice directly against skin, and hold it against your cheek for about 15 to 20 minutes at a time, then give the skin a break before reapplying. Cold can help numb the area somewhat and can reduce swelling in the surrounding tissue, which sometimes takes a noticeable amount of pressure off the throbbing sensation. Number 3, over-the-counter pain relievers, used exactly as directed on the packaging, no more and no less. Common options people use for dental pain include ibuprofen or acetaminophen, and some people find alternating between the two, following the instructions and timing on each product's label, provides more consistent relief than either alone. Always follow the dosing instructions printed on the package and check with a pharmacist or doctor first if you're taking other medications, are pregnant, or have any condition that affects which pain relievers are safe for you. Number 4, clove oil. This one has been used for dental pain for a very long time, and there's a reason it keeps coming back up in home remedy lists, generation after generation. Clove oil contains a compound called eugenol, which has a natural numbing effect on tissue. Put a small amount on a cotton ball or a cotton swab and dab it gently directly onto the painful area, avoiding the surrounding gum tissue as much as possible since it can be irritating in larger amounts. A little goes a long way here, so use a small amount rather than soak in the area. Number 5, a cooled peppermint tea bag. Steep a peppermint tea bag as you normally would, then let it cool in the refrigerator for a few minutes until it's cold but not frozen, and hold it against the affected tooth or gum area for a few minutes at a time, reapplying as needed. Peppermint has a mild numbing quality, and the coolness of the tea bag adds an additional soothing effect, similar to the cold compress approach, just more localized. Number 6, a diluted hydrogen peroxide rinse. Mix a 3% hydrogen peroxide solution, the same low concentration sold at any pharmacy, in equal parts with water, swish it gently in your mouth for about 30 seconds, and spit it out completely. Then rinse your mouth with plain water afterward. Never swallow it. This can help reduce bacteria in the area and may help clear some surface debris. But this one deserves a specific caution. Don't use it frequently or for extended periods, since overuse can irritate soft tissue in the mouth, and it should always be diluted, never used at full strength. Number 7, crushed garlic applied gently to the area. Garlic contains a compound called allicin, which has natural antibacterial properties, and some people crush a fresh clove into a rough paste and apply a small amount directly to the painful tooth or gum for a few minutes before rinsing it away. It has a strong taste and smell, so this one is more about the antibacterial effect than comfort, and it can cause a mild burning sensation on sensitive gum tissue for some people, so start with a very small amount. Number 8. Elevating your head while you sleep. This sounds almost too simple to matter, but it genuinely helps a lot of people. Lying completely flat increases blood flow and pressure to your head, which can intensify that throbbing, pulsing quality of tooth pain, especially at night. Propping yourself up with an extra pillow or two so your head sits higher than your heart can noticeably reduce that nighttime throbbing and make it easier to actually fall asleep. Number 9. Avoiding specific foods and temperatures while the area is inflamed. Very hot foods and drinks, very cold foods and drinks, sugary foods, and anything hard or chewy that requires pressure on that side of your mouth can all aggravate an already inflamed, infected area. Sticking to lukewarm, soft foods for the time being and chewing on the opposite side of your mouth whenever possible won't fix anything, but it removes a lot of unnecessary aggravation while you're already dealing with enough discomfort. Number 10. A baking soda rinse. Dissolve about half a teaspoon of baking soda into half a cup of warm water and swish it gently around the affected area. Baking soda is alkaline, and it can help neutralize some of the acidity in your mouth and create a less hospitable environment for the bacteria contributing to the infection and the irritation around it, similar in principle to the salt water rinse, just through a slightly different mechanism. Beyond those 10, there are a couple of general supportive habits worth mentioning, even though they're less specific than a targeted remedy. Staying well hydrated supports your body's overall ability to manage inflammation and keeps your mouth from drying out, which matters because a dry mouth tends to feel more irritated and can make existing discomfort feel sharper than it otherwise would. Getting adequate rest matters too. Your immune system does a meaningful amount of its work while you sleep, and skimping on rest while your body is actively fighting an infection, even a localized one in a tooth, tends to make everything feel more intense the next day. Neither of these replaces any of the 10 approaches above, but they set the stage for those approaches to actually work as well as they can. Now, a few important notes that apply to every single one of those 10 approaches, because I don't want anyone walking away from this video with the wrong idea. None of these remedies treat the actual infection sitting inside or around that tooth. They can make the pain more manageable. They can take the edge off while you're waiting for a dental appointment, or while you're dealing with something mild that isn't accompanied by facial swelling, fever, or any breathing or swallowing symptoms. But the dead or infected tissue that's actually causing the problem is still there the entire time you're using any of these, and it still needs a dentist to resolve it properly, whether that ends up being a root canal or an extraction. If your pain is severe, if it's getting worse instead of better over a day or two, despite trying these approaches, or if you notice any of the warning signs described earlier in this video, the swelling, the fever, the changes in breathing or swallowing, none of these 10 remedies are the right next step. The right next step at that point is an emergency room or an urgent dental visit, immediately, not another home remedy, and not waiting to see if it improves on its own. I also want to be honest about something else. Some of these remedies work better for some people than others, and none of them are guaranteed to bring significant relief for everyone, because the severity and exact cause of dental pain vary so much from person to person. If you try several of these and you're still in significant pain, that itself is useful information. It tells you the level of infection or inflammation is more than a home approach can manage, and it's time to get seen rather than keep experimenting. Let me answer a few questions I know are coming up in the comments before you even ask them, because these come up constantly whenever this topic gets discussed. Can you combine several of these remedies at once? Generally, yes. Most of them work through different mechanisms and don't conflict with each other. A warm salt water rinse followed later by a cold compress, alongside an over-the-counter pain reliever, taken exactly as directed on the label, is a completely reasonable combination for a lot of people. What you want to avoid is layering multiple things directly onto the tissue at the same time. For example, applying clove oil and then immediately following it with a hydrogen peroxide rinse, since that just increases the chance of irritating already inflamed tissue rather than adding any extra benefit. How long is it reasonable to manage this at home before seeing a dentist? If you're dealing with mild to moderate discomfort with no swelling, no fever, and no breathing or swallowing symptoms, it's still worth scheduling a dental appointment as soon as you reasonably can, rather than waiting to see how things go, because, as we covered earlier, the underlying dead or infected tissue doesn't resolve on its own no matter how well the pain is managed. A day or two of home management while you wait for an appointment is very different from weeks of relying on home remedies instead of ever getting seen. If home approaches stop helping, or the pain starts trending worse instead of better over a day or two, treat that as urgent rather than something to keep sitting on. Is it normal for the pain to come and go rather than staying constant? Yes, and this can actually be a little misleading. Pain that eases up for a day or two doesn't necessarily mean the infection is resolving on its own. Sometimes it means pressure has found a way to release, through the surrounding gum tissue, for example, which can temporarily reduce pain, even though the underlying infected tissue is still very much present and still needs treatment. Don't let a temporary lull convince you the problem solved itself. What about children specifically? The underlying biology here works the same way in children's teeth as it does in adult teeth, dead or infected tissue, bacteria finding that tissue, an antibiotic only quieting the bacteria rather than resolving the source. For the home approaches, some need adjusting for a child. Clove oil and hydrogen peroxide rinses generally aren't recommended for young children because of swallowing risk and tissue sensitivity, and dosing for any over-the-counter pain reliever needs to follow pediatric guidance printed on the packaging or given by a pharmacist or pediatrician, never adult dosing scaled down by guesswork. A warm salt water rinse, a cold compress against the cheek, and simply avoiding aggravating foods tend to be the gentlest, lowest risk starting points for a child dealing with tooth pain while you get them in front of a dentist. Do these approaches work the same way for a cracked or chipped tooth as they do for an infected one? Some of them can still help with general sensitivity and discomfort from a crack, a cold compress, and avoiding hot or cold foods, for example, but a cracked tooth carries its own separate risk of bacteria getting in through that crack over time and eventually leading to exactly the kind of infection this whole video has been describing. A crack or chip is its own reason to get evaluated by a dentist, whether or not it happens to be painful right now. Here's the honest summary of everything we've covered. A tooth infection starts with dead nerve tissue inside the tooth. An antibiotic can knock back the bacteria that colonize that dead tissue, and it can be genuinely life-saving when an infection is spreading toward your eyes, your throat, or your breathing, which is why you should never refuse one in that situation. But an antibiotic alone doesn't remove the dead tissue causing the problem, which is why symptoms so often return weeks later if the tooth itself isn't treated with a root canal or an extraction. And while you're navigating all of that, waiting for an appointment, or managing something mild, the 10 home approaches we just walked through, saltwater rinses, cold compresses, over-the-counter pain relievers used as directed, clove oil, cooled peppermint tea bags, diluted hydrogen peroxide rinses, crushed garlic, elevating your head at night, avoiding aggravating foods, and baking soda rinses can genuinely help take the edge off in the meantime, without ever replacing the actual dental treatment your tooth needs. Hopefully, this clears up not just why and when an antibiotic is actually needed, but also its real limitations, and gives you some genuinely useful, low-risk options for managing the pain in the meantime without pretending any of it is a substitute for proper dental care. Protecting your health means understanding the difference between symptom relief and actually solving the problem, and now you know exactly where that line sits. If you take one thing away from all of this, let it be this distinction: comfort and cure are not the same thing, and confusing the two is exactly how a manageable dental problem quietly turns into a much bigger one. Managing pain buys you time and comfort. It does not buy you a resolved infection. Only a dentist, evaluating that specific tooth, can tell you whether you're looking at a root canal, an extraction, or something else entirely. And the sooner that evaluation happens, the more options you typically have, both for the tooth itself and for your wallet, since dental problems addressed early are almost always simpler and less expensive to treat than the same problem left to progress for months. This video is for educational and informational purposes only. It reflects my own personal opinions and observations based on things I have come across on YouTube, Google, and various news sources, and it is not medical or dental advice of any kind. I am not a dentist, doctor, or any kind of licensed professional, and nothing in this video should be taken as a diagnosis, treatment plan, or a substitute for care from a qualified medical or dental professional. Tooth infections can become serious and, in rare cases, life-threatening if left untreated, and the home approaches described here are intended only to help manage mild discomfort, never to delay or replace proper dental or medical treatment. If you or your child are experiencing facial swelling, fever, difficulty breathing or swallowing, or pain that is severe or worsening, seek immediate care from a dentist or an emergency room rather than relying on any information in this video. Please use your own judgment, consult a licensed professional for anything specific to your situation, and treat everything here as a starting point for a conversation with your dentist, not a replacement for one.